Well, good morning, good afternoon, or good evening, wherever you're joining us from around the world. My name is Wendy Danicourt, and it's truly a privilege to welcome you to this training on Inside Accreditation, the path to becoming a credentialed surveyor with American Accreditation Association, the healthcare area. Whether you're a qualified professional, clinical leader, or curious change maker, this webinar is your backstage pass into the world of healthcare accreditation. Today we'll walk through what it means to become a credentialed surveyor with AAA Healthcare. You'll get a real feel and real quick for the tools, techniques, and trainings that set our surveyors apart. So again, welcome. We're honored to share with you the journey of AAA Healthcare Surveyor. I do want to say, let everyone know that the session is being recorded for future reference. And also we use our chat box quite a bit. So I would love to hear where you're watching from, and also let us know if you have had opportunity to go through healthcare accreditation before, or if you've even been a surveyor before. We'd love to hear that, and also drop your email in the chat if you'd like to get further information about this opportunity to potentially become a healthcare surveyor with American Accreditation. So let's take a quick look at our agenda today. So today, I will go over a quick who we are, American Accreditation Association. You'll hear me reference it as AAA. I'm Wendy Danicourt, head of the healthcare accreditation portion for American Accreditation Association. You'll see we have a number of lines of business, and I'm excited to share that with you. Then we'll go over why someone might want to become a surveyor. And then a quick glimpse at what our 2-day training would look like that's needed to qualify to take our exam to become a surveyor. And I'll mention it now, but I'll mention it at the end of this session as well. We have a training in July coming up. So we would love to have some of you that are interested in healthcare quality and patient safety join us on that. And we'll go through the credentialing process of how you actually get the credentials for American Accreditation Healthcare Surveyor. So, but before we talk all about becoming a surveyor, let's talk about what we do here at American Accreditation Association, to our organization, what we represent, because to understand the role of the surveyor, we need to first understand who we're surveying for and what it's all about. So the American Accreditation Association is not just a name or a logo. It's a growing global community committed to better healthcare wherever you are in the world, whether you're joining us today from capital city, a remote village, a national ministry, or a small private clinic. AAA exists to meet you there. And it's one of the great things that I like to share that makes us a little different than the other accreditations that are offered, and that we are very concierge. We work with our healthcare entities, the people that are seeking accreditation, and help them meet the highest standards that they're capable of meeting in their area on that. And because we believe, excuse me, because what we believe is simple but powerful. Every patient deserves a safe, effective, compassionate care regardless of geography, size, or resource on that. So with American Accreditation Association, we are internationally recognized. We're headquartered in Virginia in the States. We do have an international office in London, UK as well. And we operate in 52 countries worldwide. So that's pretty exciting, large breadth and reach for American Accreditation Association. But beyond our legal framework is something more meaningful, our mission-driven approach. We partner with healthcare organizations of every size and shape, large regional hospitals, small community clinics, behavioral health centers, diagnostic laboratories, dental and specialty practices, and even academic institutions. So again, whether urban or rural, public or private, establishing or emerging, we meet organizations where they are and support them in aligning with best practices, elevating safety standards, and creating systems for sustainable improvement. And I just want to emphasize, we're not just auditors. We're not just there to find out what they're doing wrong. We celebrate what they're doing right. We help them in areas that they may have opportunities for improvement. And we see ourselves really as a partner with the organizations, and helping them in their progress and in providing excellent quality care to their patients. We walk alongside the healthcare leaders as they build cultures of safety, transparency, and excellence, not just to pass a survey. We're not there just to do paperwork. So AAA is a third-party accreditation body that delivers accreditation services according to various international standards. AAA services include a range of accreditation programs using international standards. We have been certified by ESQA, so we're very excited about that. And then, as you can see on the board or on your screen, that you can, we do a number of accreditations. Of course, I had to put healthcare on the top, but we also do accreditations for training providers, schools, testing calibration laboratories, medical laboratories, personnel certification bodies, system certification bodies, product certification bodies, inspection bodies, and proficiency testing providers. That's a lot of work that we do. So AAA, we're very proud that we have such a diverse lines of service that people can seek accreditation for. And with that, we pride ourselves that we are able to work with various entities. And often we intermingle the two when they cohabitate on that. So we may have training, a hospital that's also a training hospital on that. So it's very exciting to see that on that piece. And if you have any questions, again, on any of these other certifications, please drop a line in the chat and we will have someone from AAA reach out to you to talk about those opportunities. So, and back to AAA and what we are standing for. So our vision really is to provide international accreditation that's accepted globally. And this means that we work towards world war healthcare organizations, no matter where they are located, can pursue meaningful, respected, and culturally relevant accreditation without being forced to choose between quality and accessibility or between local identity and international credibility. On that. And the vision isn't just aspirational, it's actionable. As a surveyor, you're the ones that are seeing our vision come to life every time you work with a facility towards their accreditation and their survey. You're helping them with their compliance, their improvement, and really their pride in their work and their systems, and making it visible, valuable, and achievable on that. So our mission is to deliver independent international accreditation programs that provide global accepted confidence of the competence for the accredited organization. So really, let's unpack that. It means independent. We're not tied to any political systems, donor agendas, or commercial influence. Our evaluations are objective and based on internationally recognized standards that have been approved by ESQA. And programs refer not only to our accreditation pathways, but also the technical assistance, training, policy development, and capacity building support we offer along the way. That is something unique, I think, that AAA does as well. We have a group of consultants that also provide services to help organizations be prepared for the surveys or to help them expand their services on that. And mostly, and I feel like it's the most important, we aim and instilling confidence, not just in leadership, but in staff, the patients, funders, and regulators, everyone that we come in contact when we're doing a survey. And I want to say that when a healthcare organization becomes accredited through AAA, it sends a clear message. We are committed to excellence, we are accountable, and we are ready to be trusted. So that is not only something we live by here at AAA, but the healthcare organizations can take as well, for their staff, their patients, and any of the funders that they may have. So now quickly, our strategic objective, again, provide international accreditation that inspires confidence and quality of the services. We want to promote the acceptance of accredited results international and amongst global partners, and to continue to strengthen our operations teams, developing capacity, capability to exceed expectations of our customers and stakeholders, and deliver accreditation at the highest quality and technical standards possible. That's our goal and strategic objective. So here are our values that I wanted to share with you. Excellence, innovation, transparency, professionalism, and leadership. I won't go into great detail. I think they speak for themselves. We want to be the best that we can possibly be for our consumers, and we want to treat them with utmost respect. And every day we want it to be a little bit better. So let's do a quick review about why accreditation matters, other than someone told you that you had to do it. That's important, but also let's look beyond that. So because accreditation is a formal process, and it's been recognized, our process has been recognized by another entity, ISCA. We evaluate and certify, accredit that healthcare providers, organizations meet predefined international accepted quality standards, but it's more than, someone telling you to do it or a piece of paper on the wall. It's an opportunity for it to be a pathway to better patient outcomes, safer clinical practices, strong leadership as well, and more sustainable systems. The process is structured, objective, and evidence-based. It includes document reviews, staff interviews, facility walkthroughs, and most importantly, deep collaboration. And through accreditation, we're not just checking compliance, we're helping them raise the bar on their care, their services, their staff involvement, and keeping it there. So we like to say a AAA framework is aligned with the principles of ESQA, which is the International Society of Quality in Healthcare. Sorry, should have told you that earlier. And they set the global benchmarks for how accrediting bodies themselves are governed and evaluated. So we had to go through the same kind of process that healthcare organizations went through. And we want to keep these standards and want to continuously help organizations drive improvement, and really continue on. So with our healthcare standards, accreditation standards, we have two sections, patient-centered and organization-centered on this. The patient-centered, these are the standard topics that we follow: patient rights and responsibilities, access, assessment, and continuity of care. So following that patient throughout their entire journey of the healthcare system, or experience. Provision of care, medication management and use, surgical anesthesia, care, diagnostic services, and procedures. And then, as I mentioned, we have the organizational centered standards here, and here we have the corporate governance and leadership, quality improvement, sustainability, staff planning, continuous improved performance, health record and information management, infection control, hand hygiene, and facility and physical environment safety on that. So with the healthcare accreditation, we're not only looking at the patient's journey, what they're experiencing, all the care that they're getting, following through that, and looking at that in great detail. We're also looking at the organization and how it's functioning to help support that patient care. For example, on here we have the staff planning continuous improvement. So gathering information perhaps from the patient side of things and how are they using that is an important thing that we look for. Not just that they gather data. We know that there's a lot of data in healthcare, a lot of paperwork in healthcare, but what do you do with that? So we're looking at the big picture and the entire flow and how organization center standards also impact patient standards and how patient standards guide the organizational standards on that. So some of the benefits of accreditation to the industry and trade accreditation, we really facilitate trade, eliminates need for repetitive testing, certification, and inspections. In many regions, we work with government entities such as Ministry of Health or other organizations to combine what are we looking at in our accreditation, what do they need in their accreditation, so that we're not having the hospitals or other healthcare providers having to go through the same surveys over and over and over, but we work in conjunction with them, which is very nice. I think and very helpful on that. To the regulators, we provide a reliable and impartial basis for sound decision making. So who's looking at what needs to happen on that? To conformity assessment service providers, testing, medical laboratories, certification bodies, inspection bodies, an effective marketing tool, and passport to submit tenders to contractors that require independent verified conformity, and to users of accredited services and consumers. So by going through the survey and getting accredited, that brings more weight and justification why they should come to you. It proves that you had someone independent come in that was not affiliated with you, going through all of the information. And when I say going through, it gets very intimate, going through all the details, all policies, procedures, speaking to patients, speaking to funders. So it's very in-depth, and you have someone, an external body, saying that you are doing an excellent job or you have reliable services, depending on your service. So some of the enhanced support systems that we provide here at AAA are our resources that we have available on this, that we, again, are adaptable based on where you are in the world, what resources you have available on that. We do have an alignment, and when we need to make modifications or using that adaptability, we have a team that we work with to verify that we maintain that adaptability and we're maintaining our standards. We offer trainings, lots and lots of trainings above and beyond this webinar or the training to become a surveyor. But we do trainings on quality, trainings on patient tracking, on documentation, pretty much anything that you want, we could do the training. We're very involved with our service, with our customers as well, not just through email contact, but true communication of how things are going, what do they need. In healthcare, we're ever changing. It feels like it changes every week, if not every day. And we want to keep up on what our consumers and the communities need so that we can be prepared to help them succeed without it becoming a burden on their systems on that. And then our flexibility, we're very flexible in the services that we provide, such as our surveys can be on site as well as online or a hybrid of both. And very flexible where we meet and how our surveys flow on that. So here is a quick representation of the accreditation process. And it's not set in stone, it's just a kind of a overall guesstimate of this. The first round is getting prepared. Are you prepared, doing things like mock audits, walkthroughs? Do you have your paperwork? Just deciding you want to do they want to do accreditation. Once they do that, then they submit for to apply for our accreditation. And one of the first steps after that is providing their documentation. We like to review the documentation before we come on site or video on site to have that. So we are very efficient in that aspect and that getting that document reviewed. And then we have our survey, as I mentioned, it could be online or in person or a combination of both. And it can be anywhere from 1 day to a week, depending on how many locations, how large the organization is, and how complex the system is that we are going to be surveying. And then the accreditation decision, that is, once the survey is done, we as surveyors compile our reports, and then it is submitted to the accreditation committee, who reviews and has opportunity to ask questions on that. And then we have the decision made on that piece. So, but we at American Accreditation walk through them and very active with the healthcare providers all throughout this, as well as the surveyors that are throughout this. Once we get a entity that's ready or interested to seek accreditation, we look at where they're located, the services that they're provided, and start reaching out to our team of surveyors to see who's available and who would be most appropriate to fit with that entity. So our model, again, very collaborative. We are not punitive. We are not there to find what you're doing wrong. Will we find things? Yes. As surveyors, we may come across things that could use improvement, or they misinterpreted standards, but we are there to guide them of also what they could do to fix those standards as well. So please don't see it as an opportunity to be punitive. It's really a collaborative team effort from from American Accreditation, the surveyor, as well as the healthcare entity and any consultants that they may be working with. Our model also global relevance, locally adaptable, looking at what they can do, the services provided, and having an understanding of what's allowable in the regions is something that we provide. We pride ourselves with knowing, and we educate our surveyors before they go into a area, perhaps a community that they don't know or a region that they don't know well, but they know the healthcare system, clinical services well. We provide the education and the standards of what to expect regionally on that, and we are always available to help resolve any questions on that piece. And we're risk-based and scalable, so that is an important piece of the accreditation and our model that we have here. So the surveyors, really what you would do as a surveyor, observe, looking care delivery in real time. So it is live, you're active, going around, speaking to patients, speaking to nurses, speaking to doctors, orderlies, maintenance people, cleaning people, everyone. You would conduct tracers, and we'll go over a little bit about what a tracer is, but following either a patient all the way through their system, following processes such as preparing surgical units for surgery, and medication tracers, things like that, as well as many staff interviews, not just of the leaders, but of the line staff as well. So that's always fun. I enjoy doing those because I always learn something new. Reviewing of documentation. Yes, as you know, documentation in healthcare. This is not just the policies, procedures, their reports, but also looking at their medical records, their communication with patients, what kind of education do they give them, how do they document, how do they educate one another, how to shift change notes, things like that. So any documentation that there is. And we offer feedback, and you would write a report. So the feedback is very specific to what you're surveying on, giving them suggestions, preparing the report. We have a nice template that we use already. Our scoring sheet is in Excel, so that's automatic, but we like to give detailed information back so that the organizations, if there's anything that they need to change or perhaps opportunities to enhance and improve on, that they have meaningful and actionable feedback so that they can actually, they know what they need to do on that piece. So it's very exciting. Sounds simple, but it's a lot of work, I will tell you that. So we do make an impact around the world. That's our little map of our 52 areas that we've gone to. I think we need to add a few more dots just in this past couple months, which is very exciting on that piece. So as you can see, we're very diverse on where we're working. So why become a surveyor? Well, you must have some idea of why you want to become a surveyor. Love to hear in the chat, see in the chat why you would want to be a surveyor. I can tell you the reason I became a surveyor back in the day was because I wanted to help other organizations meet the high standards that some of the high profile, very expensive, very exclusive organizations had with their accreditations. And I thought other organizations needed that as well. And with that, it was able to make an impact to care, make things better, enhance not only the care, but the way that the providers, nurses, doctors, every administrative staff felt about the care that they were providing too. It's very exciting and it's a great achievement for them to, and testament to their dedication to healthcare when they receive accreditation. It's also an opportunity to expand your professional reach. I can tell you every time I worked with another organization, I learned something. They would do things a little differently in ways that I didn't think of doing things. So that was very exciting. I like to see the diversity in that. And then join a global network of experts, which is fun. As I mentioned, we have a group of consultants. So if you also want to become a consultant, drop us a note. And we can have that conversation. But it is great to know. It's a great resource to reach out to. When I have questions, I have a large library of people that I can reach out to and that you would be able to reach out to as well. So as I mentioned, why are you interested? I'm going to open my chat, see if I get anyone there. So yeah, so why would you be interested in doing this? Love to hear. Anybody want to drop anything in the chat to share on that? Oh, look at all the chats I got. That's great. There. Thank you, thank you, Yasmin, for dropping something in. Oh, community advancing healthcare systems. Absolutely. Quality of service. That's going to be repetitive, especially in our training in July. Oh, we've got some people that are already assessors. That's great. And looking to understand not just locally, but expanding globally. This is exciting. I hope many of you sign up for the training. Oh. So yeah, so as I mentioned, we are having a training in July. So if you want to join that, I'll have a QR code at the end that you can scan to register on that. And it's going to be 2 days, and I'm going to spend a little time going over what it would be on that. So really 2 days. First day is going to be foundation, second day mastery and evaluation. We're going to go into great detail here on day 2 of that training. But let's look, keep moving my clicker. There we go. So really day 1, the foundation, we're going to look again, introduction, going into more detail. There are a lot more steps than the steps that I showed you on the slide previously about the survey journey, survey journey for a healthcare. There's a lot of moving pieces behind that. And we will go through all of that, all of the communication that we have, both with the healthcare entities as well as with the surveyors. We'll be going through that, discussing that, asking your feedback. I will tell you the training is very interactive. And that's part of the scoring is the interaction, because again, it's an opportunity for us to learn how can we make things better also. We will go through all of our tools that we've created here at American Accreditation Association to help you not only score the actual survey, but what are some other tools? What are some examples of things that we're looking for? If someone's doing quality improvement evaluations, what does that look like? What should they be measuring? How do they measure? How do you do dashboards? Documents, we have lots of documents for you. And I have to close the chat because I keep looking at all the great answers. Documents on that, not only just the standards, but what other information is there? We have tracer guides, the methodology of what we do, how we do it, going over, we've actually identified and helped prompt questions for each section on that as well. So that's, we'll be going over that. We will be going over the actual standards as well. But it won't be as in-depth detail on the standards as we do with our consultants who are getting them prepared. But we have that recording. So if you're coming to our training, we will also send you the recording for the training of this and going into detail of all the standards on that. And so you would want to watch that prior to attending our training and go through that piece. I will say some of the, with our standards, we will also, excuse me, on day one, through the tools and documentation, we'll also go over how do we decide which standards applies to which entity, because things are very different, right? We have specialty clinics, but in those specialty clinics, they may be doing outpatient surgery and outpatient surgery with some anesthesia. Well, what standards apply to that? Versus the dental center or versus a specialty clinic that does outpatient or a hospital that does it all. As well as possibly even a mobile center. How does that impact what we look at? But they don't have a facility. So what do you look at there? So we have been working very hard to make it user friendly for not only the healthcare providers, but the surveyors, and knowing what standards are being applied to each of the entities that they're working with on that. And then in day one, we'll also be going through scoring, documentation, how to get prepared for you to do the survey on the site. What information do you get? What is happening there on that piece? And then we have the opening and closing site survey. We provide scripts and things like that of what to say during the opening and the closing, because it's very important for the entities to understand at the end of their survey, you're not providing that accreditation. It has to go to the accrediting committee, right? So we've come up with scripts and things like that. So we go over that and we talk about how they try and get you to trick you into saying that they're accredited and things like that. It's going to be a fun day. And then on day two, we talk about mastery and evaluations, further deep dive into the standards. We're going to do some walkthroughs, some examples, have conversations. We'll give you a synopsis and a scenario of things, and then conversations about what standards apply, how would you rate that, why you rated it the way you did. So again, very interactive. We'll do a simulation and mock survey. And we're also going to talk about ethics, cultural competency, conflict management. You might go conflict management. When they don't agree with what you're saying, how do you address that? And then going over all the reports, feedback, and the credentialing pathway of not only the actual survey, but you as a surveyor, what the next steps would be on that. And as I mentioned, this is just a quick snapshot. We go into great detail during our training on tracer methodology. I love tracers. I love watching the whole story unfold. Things from following a patient or process from start to the outcome. And actually, I should modify this to, we go beyond the outcome. So what do you do with the outcome? Does it just sit on a piece of paper and it's a piece of data, or do you make changes? So that continuous process improvement is very important. We talk about go into detail about how to do observations, the interviews, again, the type of model of interviews that we prefer to see. We also provide questions. How do you document these tracers on that? And I really think that the tracer method is a cornerstone of our approach, because in reality, the entire thing is a tracer, right, of their whole system, and is exciting. And I like to get beyond what they show me on paper or on PowerPoint, because we can make it all pretty, right? But I want to see what is really happening, what's going on. So, and then with your credentialing pathway, so attend that training that I've referenced, and if you can't attend in July, we'll probably be doing another one later in the year on that. So make sure you follow us on LinkedIn. We post all of our trainings and webinars there. There will be an exam with the training as well, but you will, for the training, since it is 2 days and we know people may have to work or things like that, you do have to attend at least 80% of the live training to then be able to have the exam on that. And then with the exam, it's the same thing. You have to have 80% or higher for that. And the exam is multiple choice questions as well as a narrative. And we provide us, again, a scenario, and we want to see how you would score and rate that. Then you would get your digital badge and certificate. Yay! Do some exciting things there and join the AAA survey roster on that. And we have some great fun with our survey teams on that. We have a great big WhatsApp group, and we chit chat, reach out to what's going on as we get entities that want to be surveyed and receive accreditation. We'll be reaching out on that. Just reached out to someone the other day. Organization in a country was seeking some funding from their government and had to fill out some forms and say who was coming in and what their credentials were. So we reached out who would be interested, sent their credentials in so that they could apply for that money on that. Also, as surveyors, we may ask you to participate in something like this webinar to give feedback on what it's really like to be a surveyor. How are the online surveys? Because that can be kind of daunting as well. So it's great fun. Great, wonderful group of people that we have on that. And even after, as I said, we have mentorship and ongoing support of what's happening, what's occurring. I have had a surveyor reach out. She was having some questions about some of her policies. So we had a conversation about that, and that was in her own practice that she had on that piece, but definitely ongoing support, education. We keep you updated on any changes that may be happening or some great unique things that we saw in surveys that we've done. We share with others on that. You'll get invitation to live surveys on site or virtual. That's part of the process as well. As once you become certified and you become a surveyor, we don't just send you off to be on your own. You get to shadow and observe a survey online or possibly on site as well to see, because we want to keep the momentum of the great relationships that our surveyors are providing, and the high quality standard as well. And you can see it in person. And then there's opportunities for leadership, consulting, global outreach as well afterwards on that piece. So some of the frequent questions that I get, I'll just hit this out now before we get to the questions. Is prior experience required? No, prior experience as a surveyor is not required. Prior experience working with a healthcare entity is required, but we are open to, I have a surveyor who is primarily an educator on that, but excellent surveyor as well. Are surveys paid? So surveyors are paid, and that's something we would talk to you about your contracts, and varies depending on type of surveys, location of surveys, things like that. How often will you be called? Well, I won't be calling you on the telephone. As I mentioned, we use WhatsApp primarily, or email as our communication, since we are all over the world on that. And I don't want to wake anybody up from a wonderful dream or sleep on that piece. So we'll put things out there. When you sign up for your training, you will also be asked where you are, regionally, where you would work. We do look at things like conflict of interest. Are you working with another accrediting body in a certain region? We don't want to be competition, or have any conflict of interest there. I have one where they work in a certain region. They are actually over the regulations in that region. So it's agreed they will not do any surveys in that region, because we don't want any option or any hint to conflict of interest or anything unethical on that. So that it's for international professionals. If you want to stay in your region, that's great as well. I'm in the States. I do the States as well as international on that, but there'll be times that I can't travel international. So again, we're pretty flexible. Not only meet our healthcare providers where they're at, but we meet our surveyors where they're at as well. So this is a great opportunity. I think it's a great opportunity. I'm a cool person to work with, so there you go. So if you're ready to get started, as I mentioned, the survey, and actually I have to change, I'm sorry, I need to change those dates. The training is July 19th and 20th. It's a Saturday and a Sunday. It will be starting at 10 a.m. Eastern Standard Time here in the US on that. It will get you included on hands-on training, the tools. Yeah, deadline to register. I'm sorry, I didn't put that date in there. It'll be the week beforehand to give you time to then watch the standards video on there as well. And on that, so we raise, just so you know, we raise the standards. Expert help, ready for you. Are you ready for us on this? And I'm going to give you the QR code and the link here. There we go. We got the QR code for you, our email, go back, our email, and our website. And then the link there is our LinkedIn as well. Follow us, as I said, all of our trainings are on there, very specific in that aspect on that.
Thank you
All right.
so much.
Take care. Bye, everyone.